Is exercise at night harmful? The short answer is not inherently, but timing, the heat, dehydration, and intensity matters. There isn't strong evidence that night exercise per se, like cricket or football, after 8 to 9 pm, directly causes more heart problems than daytime exercise, as long as hydration, sleep patterns, and warm up habits are good. Very important. However, high temperatures, inadequate warm up, and fatigue at night can amplify stress on the heart. And lack of sleep and poor circadian rhythm may increase the blood pressure and stress hormones, which can indirectly affect heart stress during late workouts. So, playing late at night isn't dangerous by itself, but the hydration, warm up, and recovery become even more important when your body is already tired and dehydrated. So, what about cricket, football, and intense workouts? When we talk about cricket and the other sports on turfs, which involve sudden bursts of sprinting, jumping, turning, and sustained effort, the normal response during exercises, heart rate raises significantly. In young people, it can reach up to 160 to 200 beats per minute during intense sprints and still be normal. Blood pressure increases to deliver oxygen to working muscles, and adrenaline boosts strength and speed. These are expected physiological responses and usually safe in healthy individuals, but people who are in the marginal levels of their health, which they don't know, they can sometimes be athletic, but they can have a heart attack and collapse. Sudden cardiac arrest or death during sport is real, but it is now increasing. We are now getting to see a lot more people coming to the emergency. Roughly 1 to 3 sudden cardiac deaths per 1 lakh young athletes per year we are seeing. Another large review found about 0.7 to 0.8 cardiac arrests per lakh population in athletes year during competitive sports. In general population, athletes estimate vary between 1 to 50,000 per year. In young athletic population, it's, in simple terms, the chance that a fit young person will have a cardiac arrest while playing football or cricket is low, but it is not zero. It is increasing now. So, what are the triggers underlying silent cardiac conditions? Most sudden events have not happened because of the sport itself, but because of intense exercise triggers a fatal rhythm in someone with hidden heart disease, especially who are diabetics, who are hypertensives, who are on drugs, who are not being exercising regularly after a full stomach are some of the conditions. Common ones include hypertrophic cardiomyopathy, thickened heart muscle, congenital coronary anomalies, and abnormal arteries, electrical disorders. They are the dangerous arrhythmias, myocarditis, often post-viral inflammation. These conditions may never cause symptoms until the heart is stressed, especially by intense bursts of activity. So, does the type of sport matter? Yes. Sports involving sustained intense effort and sudden bursts like football, cricket, running, basketball have higher reported cases of ICD compared to sudden cardiac death compared to low intensity activities. Male athletes, particularly in football, soccer, often show a higher incidence than female counterparts. Repeated higher impact or endurance training without adequate recovery has also been linked to structural change in the heart over years. So what's the difference between a heart attack and a sudden cardiac arrest? That's very important. Heart attack is a myocardial infarction caused by blocked arteries, more common in older adults, leads to part of the heart muscle dying. Sudden cardiac arrest is caused by electrical malfunction. The heart suddenly stops pumping blood, and more common in young athletes with silent electrical or structural heart disease. You see in viral videos, they are just talking in the mic and just faint and they die. They fall down and dead. Similarly, they are just bowling and they're coming to bowl and they're dead. So these are because of electrical conduction. Most exercises related causes are in young athletes are due to sudden cardiac arrests, not classic heart attacks. So is exercise dangerous? Not at all. Regular physical activity is beneficial. Lowers risk of coronary artery disease, reduces blood pressure, improves cholesterol, strengthens the heart and lungs. But high intensity or sudden exertion with underlying issues who don't know they have them at all are the major problems. How can athletes protect themselves? So by pre-participation screening like ECG, history examination, especially for competitive athletes, they can identify the risk factors before a catastrophic event. Warm up and cool down are very, very important. Stay hydrated, drink lots of water. Hydrating is very important, especially playing on turf at night when heat may accumulate. On the plastic turf, the heat may accumulate. So know your warning signs: dizziness, chest pain, palpitations, fainting. They are all warning signs.